And there are vaccines which are given with the combinations, like 2 doses of Pfizer and third dose of Pfizer was given as booster. Or in certain circumstances where 2 doses, those individuals who have received 2 Pfizer doses, the Moderna is also combined as a third booster dose, and it has led to 72% reduction of infection. Whereas 3 doses of Pfizer vaccine is associated with 62% reduction of the infection rate. With Moderna, the rate of reduction is around 70 to 80%. So that's why, I mean, a mix and match of COVID vaccine injections are also associated with a reduction in the infection rate. What about the antibody cocktail regime? Omicron variant, may not be, controlled by probably just vaccines, but some other therapies can also be tried, and we don't have much data about antibody cocktail regime for Omicron variant, but some centers have used antibody cocktail regime like casirivimab and imdevimab has been used, but some of the small case series have not shown much effect against Omicron variant. Antibody cocktail regime may be effective against Delta variant, but it may not be effective against Omicron variant. So that's why genomic sequencing with RT-PCR is very, very important. And probably sotorivimab can be useful for Omicron variant, but it is not marketed in India, though it is likely to be available in USA in a couple of weeks or so. But antibody cocktail regime was quite useful for early infection, those who were presenting within 10 days of symptomatic period. Individuals who are at risk of acquiring infections in a vulnerable group like immunocompromised individuals, or patients who have cancer, undergoing chemotherapy, HIV, diabetic patients. And these are the individuals who are likely to be benefited with antibody cocktail regime. And then there is a role of post-exposure prophylaxis, especially for healthcare workers. Antibody cocktail regime may help prevent further rapid spread of infection. So the dose of casirivimab is 600 milligrams, but it is costly, cost around 60,000, 70,000 rupees. And so that's why we are waiting for the new preparation of antibody cocktail regime like sotrovimab, which will be able to cover a new variant called Omicron, but it is not marketed. The dose is around 500 milligrams. So what about the role of molnupiravir? So there are a lot of encouraging results pertaining to the use of molnupiravir. So molnupiravir is also associated with mRNA polymerization prevention. So basically, it is useful in non-vaccinated individuals. The studies of molnupiravir is done on unvaccinated individuals, and it is found to be useful in preventing spread of infection. The severity of infection is also prevented, but it has to be used cautiously in pregnancy, and it is also associated with other complications like hepatotoxicity. So we need to have our own data, because in India most of the individuals are vaccinated. We really don't know whether molnupiravir will be effective against those vaccinated individuals. So we need to have our own data, and that's what we need to also identify whether it is Omicron or not. And probably it may not be useful against Omicron infection. So as for what about the role of remdesivir? Remdesivir is still useful. The recommendations, ICMR guidelines have still proposed the role of remdesivir for mild to moderate infection, especially those who are hospitalized and requiring oxygen with early infection. Probably remdesivir may be useful. The role of steroids, yes, the role of steroid remains the same compared to previous strains and new strain. There is not much of a change, and the steroids are indicated in patients requiring oxygen. So studies also have shown 7% reduction in mortality was identified with the steroid studies, and it is still proven effective, especially those individuals who need oxygen. What about the role of hydroxychloroquine and ivermectin? There is no role. People are still using it with uncertain results. So but it should be avoided as far as possible because it doesn't have any documented benefits. What about the role of anticoagulants? Yes, anticoagulants are indicated in individuals who are at high risk, immobilized patients, bedridden patients, at risk, individuals who are at high risk of developing deep vein thrombosis, obese individuals, and individuals with COVID-19 and D-dimer level elevated more than 2 times. Probably these are the individuals who should receive anticoagulation. Because we also have seen a lot of individuals coming with myocardial infarctions, and a few patients have come up with pulmonary embolism also. So it is essential to continue anticoagulation in high risk individuals. And oxygen support remains the same even with the Omicron variant. Those individuals were not vaccinated, causing severe infection. Initially, the oxygen support can be with the nasal prongs for mild, probably infections, and then if the oxygen nasal prongs is not helping, Hudson mask, high concentration mask, and can be graduated to high flow nasal oxygen devices. High flow nasal oxygen devices are only indicated for mild infections. But for moderate infections, non-invasive, mild to moderate category, non-invasive ventilation can be provided. Okay, and NIV will be able to help, prevent intubations, unnecessary intubations. But those individuals who are even not responding to non-invasive or BiPAP should straight away get intubated and receive invasive mechanical ventilation with ARSNOT protocol. Lung protection ventilation strategy should be employed. Prone positioning should be employed, and routine care in the ICU is very, very important. It is good housekeeping in the ICU that is going to prevent the deaths in the ICU rather than the fancy stuff, advanced things. Okay, we should stick to the basics. Our routine care should be very good. Infection prevention should be very good. Early identification of the worsening of the patient's condition is very important. Okay, and then everyday assessment and the goal-oriented approach, a multidisciplinary approach, is all that is more useful rather than the fancy stuff that we are seeing. And then we should have our own data. India should have our own data pertaining to the strategies that we have employed preventing spread of infection, strategies that we have employed to control the affected individuals' mortality. That is very, very